Welcome to New York City Health and Hospital Kings County YouTube podcast. I'm Dr. Melissa Lee, Director of the Lifestyle Medicine Program. We are taking over this season's podcast to really focus on the launch of our Lifestyle Medicine Program. In this episode, Dr. Hannah Friedman is joining us. Hannah, tell me about your particular interest in this pillar of lifestyle medicine.
Hi, Melissa. Thanks so much for having me. So I've really been interested in exercise and how to improve my own physical activity since I was in college. I was a group fitness instructor. I taught aerobics, both traditional and water aerobics, deep and shallow. And I also was a strength training instructor. So that really gave me a foundation for understanding the mechanics of exercise and why it's so important in our daily life. And since then, and throughout med school and the residency and now as an attending, it's something that I try and talk about with my patients.
You just mentioned you were interested in why physical activity is so important. Can you tell me a little more about that?
Yes. So physical activity has a whole host of benefits. And I think a lot of people associate it with the cardiovascular benefits. It's good for your heart. A lot of people know that. What some people don't know is it actually has effects throughout your entire body. So starting from the top down, there's lots of research showing that regular exercise improves your mental health, so helps improve depression and anxiety, helps to boost your immune system, your gut health, your bone health. And actually, there is research showing that regular aerobic exercise can decrease the incidence of colon and breast cancer.
So this is something that can help us prevent cancer. This is something that can help our cardiovascular health. And what more is there to say? That's fantastic. There are all kinds of exercise routines and activities out there. Why might it be important to have a balanced routine?
That's a really great question. So there are 4 pillars, we love pillars in lifestyle medicine, of physical activity. So there's aerobic, there is resistance or strength training, there's flexibility and balance. And so each different pillar or domain has various levels of importance in your body. And so there's, for aerobic activity, as I mentioned, it promotes cardiovascular health, also decreases risk of certain cancers, as I mentioned. It also improves, in addition to your mental health, improves your sleep. People have been shown to have better quality of life when they have regular aerobic activity. And then for resistance or strength training, that also has been shown to help with your sleep. It helps to improve your metabolism and your gut health. And then flexibility is particularly important to help prevent injury, or if you are injured, it helps you to recover from that injury faster. And then balance is important for everybody, but we especially like to think of it for our older population. Helps to prevent falls, which can be very detrimental to the health of our older patients.
I love that you're mentioning using exercise as really a therapy across the age spectrum, because the idea of incorporating some kind of resistance exercise or different ways to improve balance and falls in older adults is just so essential to the work that we do. So Hannah, if you had to pick one muscle in the body as the most important muscle, what would that be? And what are some tips to keep it healthy?
Well, if I had to choose, and they're all so important, I would have to go with the heart. Heart disease is the number one cause of death for all Americans, men, women, everybody. And it is so important to our health and our longevity, and having those years not only be prolonged, but to be healthy while we're living longer by improving our heart health. And so in addition to regular exercise, as I was mentioning, trying to incorporate a plant-forward or a plant-based diet and finding ways to combine those two is the best way to keep your heart healthy.
Healthy hearts. That's what we want in this lifestyle medicine program.
Absolutely.
So how does our new program at King's really encourage patients and support patients in terms of exercise and motivation to do so?
Yes. So our curriculum in the lifestyle medicine program is incredible. As part of the 6-month program, in addition to, meeting with the providers and having the weekly group meetings with the health coach and the dietitian, there is a specific 8-week program that focuses specifically on exercise. And, there are patients who may be at different levels of physical fitness when they're starting and may have different abilities to perform certain different types of activities. And so we really like to focus on something that is accessible to everybody or as many people as possible. So in our program, we focus on resistance band training, which is something you can do while seated. It's something that you can do in your upper body, your lower body, and it's something that is so important for, as you were mentioning before, people of all ages.
That's fantastic. I think that sometimes the thought of exercise or maybe the thought of going outside or needing to join a gym is prohibitive at times. And you're describing ways of engaging with exercise that you can do in your own home. Do you have any tips for people at work all week who have very little free time to engage in exercise regularly?
That's such a good question. And because, so many of our patients that we see here are very, very busy. And they, in addition to working long hours, can sometimes be working irregular hours. So they might not have the ability to go to that regular Thursday afternoon gym class. And so what I like to recommend is to try and find ways to squeeze it into your day-to-day routines. So whether that's getting off the subway a stop early and going for a brisk walk to work instead of, getting off right at your usual stop, or maybe during your lunch break, walking up and down the stairs. What I recommend is to gauge your level of physical activity by your breathing and your heart rate. And so the recommendations for physical activity are 150 minutes a week of moderate physical activity or 75 minutes of vigorous activity. And that sounds like a lot, but if you, incorporate activities during your day-to-day that pick up your heart rate and your breathing rate and kind of find little ways to squeeze it in, you might be surprised at how quickly you're able to reach those goals.
That's great. I love the idea of taking big goals and breaking them up into smaller, more manageable bites. And, you mentioned the difference between vigorous activity and moderate activity, light activity. I often think of light activity as something you can do and you can still carry a tune. And moderate intensity activity would be something where you're working and your heart's beating quickly and you can still talk to the person next to you. Whereas vigorous activity, you're probably going to want to stay inside your inner self for that one. So wonderful. Thank you for all these great tips, Hannah. And we're very excited to have you as one of the docs in our lifestyle medicine program.
Thank you for having me. Excited to be here.